Do you have one of these? A lump, a bump, a spot, or a little raised thing on your skin that you keep touching over and over again because you're not sure if it's completely normal or something you actually need to pay attention to? Then keep watching, because in this video I'm going to walk you through the most common lumps and bumps people find on their skin, which ones are usually harmless, which ones can be treated if they bother you, and most importantly, which ones deserve a closer look. Let's go. By the way, if you're new here, my name is Dr. Michael, and on this channel I talk about skin health, skin care, and dermatology in a way that's practical, honest, and not overhyped. The first one I want to start with is skin tags, because these are probably one of the most common harmless bumps people notice on their body and immediately wonder about. Skin tags are those soft, little floppy pieces of skin that are usually skin-colored or slightly darker than the surrounding skin. They tend to show up in areas where the skin rubs against skin or clothing, so the neck, underarms, eyelids, under the breasts, and groin folds are all very common locations. In most cases, skin tags are tiny, but every now and then people can grow ones that are surprisingly large. Even though they can look weird or annoying, the key point is that skin tags are generally benign. In other words, they are not dangerous. They're basically little overgrowths of normal skin. Who gets them? Honestly, almost anyone can. But they do become more common with age, they can run in families, and they also tend to be more common in areas of friction. One of the most common questions I get is, should I be worried if I have skin tags? And in most situations, the answer is no. The bigger question is usually, do I need to remove them? And the answer is, not necessarily. If they don't bother you, you can absolutely leave them alone. The main reasons people remove skin tags are if they get irritated, caught on jewelry or clothing, start twisting and becoming painful, or if they just don't like the way they look. What I don't recommend is yanking them off yourself, tying random things around them at home, or experimenting with cheap removal gadgets. Even if some people get away with it, you can end up with bleeding, irritation, or infection. So skin tags, very common, usually very normal, and generally more of a nuisance than a danger. Next up are Seborrheic Keratoses. If you've never heard that name before, don't worry, because most people haven't. These are the rough, waxy, stuck-on looking growths that often appear as people get older. They can be tan, brown, gray, or almost black. And one reason they scare people is because they can look dramatic. Sometimes they're flat, sometimes they're raised, sometimes they look crusty, sometimes they look like a wart, and sometimes they seem like they appeared out of nowhere. The reassuring part is that these are usually benign too. They are one of those classic things that can look much scarier than they actually are. They often show up on the trunk, back, chest, face, or scalp, and they become more common over time. Genetics plays a role, and sun exposure may contribute as well. The reason people notice them so much is that they often have that pasted-on appearance. It can look like something is literally sitting on top of the skin. And because they can be dark, rough, and uneven, many people worry that they're cancerous. Most of the time, they are not. That said, this is where I want to make an important distinction. A seborrheic keratosis can be harmless, but if you're not sure that's what it is, especially if it's changing quickly, bleeding, or looks very different from your other spots, that's worth getting checked. Harmless things and concerning things can sometimes look similar to an untrained eye. If seborrheic keratoses bother you, doctors can remove them in several ways, but if they're not itchy, irritated, or cosmetically bothersome, they don't need treatment. So this is another very common category of looks odd, usually normal. Now let's talk about lipomas. Lipomas are soft, squishy, movable lumps that sit under the skin. If you press on one, it often feels like it slides a little bit under your fingers. These are usually made up of fatty tissue, and they're commonly found on the shoulders, upper back, arms, or thighs. This is one of those lumps that can really freak people out because it feels substantial. Unlike a skin tag or a rough spot on the surface, a lipoma feels like there's an actual ball under the skin. But the good news is that lipomas are often benign and very slow growing. A classic lipoma is soft, not stuck in place, and usually not painful. Some people have just one. Some people develop several over time. In many cases, if it isn't painful, isn't rapidly growing, and isn't affecting nearby movement or comfort, it can simply be observed. But this is also where common sense matters. If you have a lump under the skin that is growing fast, feels very firm, seems fixed in place, becomes painful, or just does not feel like the typical soft, rubbery lipoma, that's something you should have evaluated. Not every lump under the skin is automatically just a lipoma. So lipomas usually fall into the normal and benign category, but with a simple rule: if it's acting unusual, get it checked. Next up are epidermoid cysts, which people often call sebaceous cysts, even though that name isn't always technically accurate. These are extremely common. They often feel like a round bump under the skin and may have a tiny central opening or pore. They're commonly found on the face, neck, chest, back, or scalp. These can stay quiet for a long time. You may have one for months or even years and barely think about it. But then one day it becomes red, swollen, tender, and angry looking, and suddenly it gets your full attention. A calm cyst is often benign. It may just sit there. It may slowly enlarge. It may occasionally drain some cheesy or foul-smelling material if it opens. Not glamorous, but common. The problem is when a cyst becomes inflamed or infected. That's when it gets painful, warm, red, and can even feel like it's throbbing. This is also the point where people make things worse by squeezing it. Please do not turn your bathroom mirror into a surgical center. When you squeeze a cyst aggressively, you can rupture deeper contents into the skin, create more inflammation, and sometimes make it much harder to treat. If a cyst is small and not bothering you, it may not need any treatment. If it repeatedly gets inflamed, becomes painful, drains, or grows larger, that's when you should see a doctor. So epidermoid cysts are often common and not dangerous, but when they become red, hot, painful, or rapidly swollen, they move into the needs attention category. Now let's talk about dermatofibromas. These are small, firm bumps that often show up on the legs, though they can appear elsewhere too. They're usually brownish, pinkish, or skin-colored, and they can feel surprisingly hard for their size. A lot of people describe them as a tiny button or pebble in the skin. Dermatofibromas are often thought to arise after minor skin trauma, like an insect bite, shaving irritation, or an inflamed hair follicle. Not always, but that's a common story. The reason people notice them is that they don't feel soft. They feel anchored and firm. A classic dermatofibroma is benign. It may stay for years. It may be slightly itchy or tender if you keep rubbing it. But in most cases, it's more of a cosmetic annoyance than anything dangerous. The issue with these is that they're not always easy to remove in a way that looks better than the bump itself. Because these can extend deeper into the skin, fully removing them may mean leaving a scar. So unless it's really bothering you or the diagnosis isn't clear, many people simply leave them alone. So again, common, usually normal, but worth getting checked if it's changing or if you're not sure what it is. Next are milia. Milia are tiny white or yellowish little bumps, most commonly around the eyes, cheeks, or forehead. The easiest way to think of them is as very small superficial cysts. People often confuse them with whiteheads, and that confusion leads to one of the most common mistakes: trying to pop them. Milia do not behave like regular acne. They don't always have an easy opening, and squeezing them usually doesn't go well. At best, nothing happens. At worst, you irritate the skin and create trauma where you really did not need to. These are very common and typically harmless. Babies get them, adults get them, people can develop them after irritation to the skin, after using very heavy products, or sometimes just because their skin is prone to them. The good news is they're benign. The less good news is that once they're there, home squeezing is usually not the answer. So if you have tiny little white bumps around the eyes that just won't pop, milia should definitely be on your list of suspects. Now let's go into sebaceous hyperplasia. These are small yellowish or skin-colored bumps, often with a tiny dip in skin-colored bumps, often with a tiny dip in the center, and they tend to show up on the forehead, cheeks, and nose. They're basically enlarged oil glands, which is why they're more common in people with oily skin and more common as we get older. What we are discussing is the slow. These are another example of something that is usually harmless but frequently mistaken for something more concerning. People see a pinkish or yellowish bump on the face, especially if it has a little central depression, and they worry. Most of the time, sebaceous hyperplasia is benign. But this is one of those categories where experience matters, because some skin cancers can also show up as persistent bumps on the face. So if a bump on the face is new, growing, bleeding, crusting, or just not behaving like your other spots, it's worth getting checked rather than assuming it's nothing. If it truly is sebaceous hyperplasia, it's usually a cosmetic issue, not a health issue. Now let's talk about cherry angiomas, because these are incredibly common and one of the easiest bumps to recognize once you know what they are. Cherry angiomas are small, bright red, smooth bumps made up of tiny blood vessels. They often show up on the chest, stomach, back, arms, and shoulders, and many people start noticing more of them over time. These are usually harmless. They may start out as tiny red dots and slowly become more noticeable. Some people have just a couple. Other people feel like they woke up one day and suddenly had 10 of them. Genetics and age seem to play a role, and they are one of those things that often increase gradually. The reason people worry is because red things on the skin can look dramatic, especially if one gets traumatized and bleeds. But a typical cherry angioma is benign. If it gets nicked while shaving or rubbed by clothing, it may bleed more than you'd expect for such a tiny spot, because again, it's made of blood vessels. So yes, they can bleed if irritated. No, that does not automatically mean cancer. But if something that you think is a cherry angioma is changing fast, becoming irregular, or doesn't really fit the usual look, then it's worth confirming. Next are warts. Warts are caused by certain strains of human papillomavirus, and they can show up in all kinds of places. Common warts often show up on the hands and fingers. Plantar warts show up on the soles of the feet. Some are rough and cauliflower-like, some are flatter. Some can be painful, especially on pressure points. Warts are benign in the sense that they are not cancer, but I still put them in the need some attention category because they can spread, they can last a very long time, and they can be surprisingly stubborn. A lot of people ignore a wart because it seems small, but months later they have more of them. Or they have one on the foot that starts feeling like they're stepping on a pebble every day. Warts can also get confused with calluses, especially on the feet. The frustrating thing about warts is that they're treatable, but not always quickly. Home treatments can help, professional treatments can help, but consistency matters. So warts are common and not dangerous, but they're definitely not always something to just forget about. Now I want to shift gears a little and talk about the kinds of lumps and bumps that deserve more attention, because this is really the part most people care about. It's not just, what is this? It's, do I need to worry about it? One category is boils and skin abscesses. These are painful, red, swollen lumps that often feel warm and tender. Sometimes they come from an infected hair follicle, sometimes from an ingrown hair, sometimes from deeper skin infection. Unlike many of the harmless bumps we just talked about, these usually hurt. And pain is an important clue. A boil or abscess often grows over a short period of time, becomes red, and may feel like it's filling with pressure. Sometimes it drains. Sometimes it doesn't. Sometimes people try to squeeze it, which once again often makes things worse. This is not the same thing as a harmless, long-standing bump that's been quietly sitting there for years. If something on your skin is rapidly getting larger, becoming red, hot, painful, or associated with fever or feeling unwell, that deserves medical attention. Another category that deserves attention is swollen lymph nodes. These are usually deeper under the skin rather than on the skin itself, and people often feel them in the neck, under the jaw, armpits, or groin. Many swollen lymph nodes are reactive, meaning they enlarge temporarily because your immune system is responding to an infection or inflammation. That can happen with a cold, a sore throat, a dental issue, or a skin infection. But if a lump like that persists, keeps enlarging, feels unusually hard, or isn't going away the way you'd expect, it should be evaluated. Not every lump near the skin is a skin problem. Now let's talk about the skin cancers people most commonly miss because they don't always look dramatic. Basal cell carcinoma is one of the big ones. This can show up as a shiny bump, a sore that doesn't heal, a pink patch, or a spot that keeps crusting or bleeding and then seeming to improve, only to come back again. And that last pattern is a big one. People think, well, it almost healed, so maybe it's fine. Then it crusts again. Then it bleeds again. Then it's still there weeks later. That is not the behavior of a random harmless bump I want you ignoring. A persistent spot that does not fully heal matters. A sore that keeps coming back matters. A bump that bleeds easily without a good reason matters. Squamous cell carcinoma is another one to know. This one can show up as a rough, scaly, crusted, or tender growth. Sometimes it looks like a sore. Sometimes it looks like a thick, rough patch. Sometimes it grows outward. Sometimes it's mistaken for eczema, a scab, or something that got irritated and never settled down. One of the most helpful general rules here is this. If you have a spot that hurts, itches, bleeds, crusts, or scabs, and just does not go away, that needs attention. That's a practical rule. Not perfect, but very practical. And then, of course, we have melanoma, which is the one many people think about first, but not always in the right way. People often assume melanoma has to be a large black mole, but that's not always true. The most important concept is change. A new spot that looks different. An old mole that is evolving. A lesion with asymmetry, irregular borders, uneven color, larger size, or a changing appearance over time. That ABCDE framework can be really useful. A for asymmetry, B for border irregularity, C for uneven color, D for diameter, E for evolving, which honestly is one of the most important ones because change is a major red flag. And beyond that, one of the best real-world rules is the ugly duckling rule. If one spot looks noticeably different from all the others on your body, pay attention to it. Your skin tends to have a pattern. When one lesion is breaking the pattern, that matters. So at this point, you might be thinking, okay, Dr. Michael, this is a lot. How do I actually know when something is normal versus when I should stop Googling and get it checked? Here's the simplest breakdown. Things that are often more reassuring are bumps that have been stable for a long time, are symmetrical, are not bleeding on their own, are not rapidly growing, and look similar to known benign lesions like skin tags, cherry angiomas, or classic milia. Things that deserve more attention are spots or bumps that are new and changing, sores that don't heal, growths that bleed repeatedly, lumps that become red-hot and painful, deeper masses that are rapidly enlarging, or anything that just seems clearly different from your usual skin pattern. And I want to emphasize something here. Not every suspicious lesion turns out to be cancer. In fact, many do not. But the goal is not to panic. The goal is to notice the ones that should not be ignored. A lot of people wait because the lesion doesn't look dramatic enough. They think if it were serious, it would look obviously horrible. But skin cancer and other important skin problems do not always announce themselves that way. Sometimes it's just the little sore that never completely heals. Sometimes it's the pearly bump that keeps bleeding when you wash your face. Sometimes it's the rough patch that never quite goes away. Sometimes it's the mole that your partner says looks darker than before. So if you take nothing else from this video, take this. Normal does not always mean pretty, and concerning does not always mean dramatic. Some completely harmless bumps look strange, and some important ones look subtle. That's why I usually tell people to watch for a few practical red flags. Number 1, rapid change. Number 2, repeated bleeding. Number 3, persistent crusting or scabbing. Number 4, A sore that doesn't heal. Number 5. Pain, warmth, or swelling that suggests inflammation or infection. Number 6. A new or changing pigmented spot. And number 7. Anything that just looks different from the rest. If you notice one of those, that doesn't mean panic. It means attention. And one final thing, please don't assume the internet can diagnose your skin with certainty from one blurry photo. Educational content like this is helpful for awareness, but it does not replace an in-person exam when something is truly suspicious. Sometimes the difference between a benign bump and something more serious is obvious to a trained eye, and sometimes it requires dermoscopy, monitoring, or even a biopsy to know for sure. So yes, many lumps and bumps are completely normal. Skin tags, seborrheic keratoses, lipomas, milia, cherry angiomas, dermatofibromas, and even some cysts are often benign. But bumps that are changing, painful, infected, repeatedly bleeding, not healing, or clearly different from your other spots deserve a closer look. Alright, thank you so much for watching. I hope this helped you feel a little less anxious about the harmless things, and a lot clearer about the things that actually deserve attention. If you found this helpful, make sure you like, subscribe, and leave a comment below letting me know which skin topic you want me to cover next. And if you have a lump or bump that's been worrying you, and it matches any of those warning signs, don't just keep staring at it in the mirror for the next 6 months. Get it checked.